Hi everyone. I'm recording this presentation as we had some connection issues the other day. So a very big thank you to the organizing committee for your patience and for giving me the opportunity to share my research. I know that there's not officially going to be a time slot for questions, but I'm going to leave my email address. And if anyone wants to get in touch afterwards, please feel free to do so. My name is Emma Bonthorne. I work for Aditu Archaeologia, which is a research organization based in the Basque Country in northern Spain. And I'm also a doctoral student at the University of Oxford. Today, I'm going to be speaking about an individual case of a singular burial that was uncovered last year in Pamplona as part of a rescue excavation, and that was sent to our lab for analysis. The remains were unusual for a number of reasons. Firstly, they were uncovered outside of the limits of the known necropolis, and the burial context, as well as the skeletal analysis, revealed some interesting and quite unusual results. We are still in the preliminary phases of the analysis, but this presentation will hopefully serve as a case study that can contribute to the body of evidence of deviant Roman burial practices in the Iberian Peninsula. The remains were found in the southwestern part of the city centre of Pamplona, below the basement of what was an 11th century Salesian convent. They were excavated by a local archaeological company who found evidence that supported the presence of a previously unknown necropolis. In addition to the inhumation that I'm going to speak about, they also uncovered 2 cremation burials, a number of stone and marble funerary monuments, and traces of the main road from the city that were found just beyond the limits of the convent. Interestingly, they also uncovered the remains of a horse burial around 3 meters away from the skeleton. It appears to have been deliberately buried, but it's not yet clear whether this corresponds to the same period or whether it is related in any direct way with the burial under study. The burial was uncovered with several elements that give us clues as to its chronology. These include fragments of Samian ware, a marble plaque with an inscription that's been dated to the 2nd century CE, and 2 coins most likely pertaining to the period of Constantine II. The deposit of the individual under study has tentatively been dated to the 4th century or slightly later, with C14 results pending. And the burial itself clearly corresponds to a primary burial. The individual was buried face down in a prone position, northeast, southwest orientation, with the left arm flexed beneath the abdomen, the right arm flexed at the level of the skull with the fist closed and the elbow elevated much higher than the rest of the skeleton. From the photo, you can see that the legs were flexed, and although they don't appear in this image, there were a series of hobnails around the feet, which suggests that the individual was buried wearing Caligay military sandals. We classified this burial as a deviant burial, and I just wanted to take a minute to explain this term and why it was chosen in this context. In archaeological literature, the term deviant is used to describe burials that fall outside of the expected range of burial practices for the specific geographical or chronological context. These are also sometimes referred to as irregular burials or singular burials, and their interpretations often refer to supposed fear of the dead. They're associated with the perceived othering or marginalization of an individual. Various theories have been put forward about the possibility that certain causes of death, such as suicide, execution, and drowning, may have been reasons for deviancy in funerary treatment. Essentially, what the term expresses is any kind of deviation from the norm, which of course even varies throughout the Roman period, which encompasses such an enormous chronological and geographic scope. What we have in Pamplona is an individual that appears to have been thrown into a deposit away from the city in a very unusual position, both in terms of it being prone as well as the flexed positioning of the arms and legs. The fact that it was an inhumation burial found in an area with cremations that appear to be from the same period further highlights the unusual nature of the burial. I do want to briefly state that this is not actually the only burial of its type found in Roman Pompaelo. In 2001, they uncovered a grave containing 4 male individuals who appeared to have been executed and thrown into a mass grave outside the city walls in the ruins of the Roman baths. In addition to that case, there was one other singular prone burial uncovered in a different part of the city that dated to the same period, roughly the 3rd, 4th century. Several of the individuals that displayed this kind of funerary treatment were discovered to have evidence of infectious disease, and that's one of the possibilities that we wanted to examine as part of the anthropological analysis. So we started by creating a bioprofile, looking at age, sex, and stature estimations. We were lucky in that the remains were very well preserved, with more than 95% of the skeleton present. So we were able to take measurements of most of the long bones and the pelvis and assess a lot of different elements as part of our skeletal analysis. The remains appear to correspond to a male individual, roughly 35 to 45 years old, with a height of somewhere between 1.73 meters and 1.75, or 5'6" and 5'7". Throughout the course of the anthropological analysis, we did document the presence of various dental pathologies, as well as some degenerative skeletal changes and possible activity markers. But for a short presentation, I'm going to just focus on a few very specific skeletal lesions that appear to have had an infectious origin. Starting with the shoulder girdle, we observed an irregularly shaped lytic lesion on the right glenoid cavity of the scapula, accompanied by active periostitis in the scapular body. The radius and ulna displayed bony changes that primarily affected the distal articulations. And although the lesions are bilateral, they can't necessarily be linked to an infection. They may well be osteoarthritic in nature. As we move down the skeleton, in the sacro-iliac joint, we see bone formation, which is unilateral and doesn't appear to be associated with normal processes of age-related degeneration. The individual displays extensive periostitis throughout the lower limbs, particularly the femurs and the tibias, while the right fibula shows an increase in cortical density and an infection within the trabecular bone. But it's in the vertebral column where we see the most diagnostic evidence of disease. We have diverse lesions throughout the entire spine. Generally speaking, in the cervical vertebra, these include quite advanced degeneration, lipping at the joint margins, microporosity, and lytic lesions of the articulating surfaces. The thoracic region displayed hypervascularization of the anterior and lateral vertebral bodies, and there were discolored areas of periostitis, lytic lesions, Small's nodes, as well as porosity and ebonation on the inferior articulating facets. The most severe lesions affect the lumbar spine. L1 displays pronounced anterior wedging and osseous growth in the anterior aspect of the body, with bone loss present on the inferior articulating surface. There is some ankylosis or fusion of the L2 to L4 lumbar bodies without involvement of the neural arches or the spinous processes. And L2 and L3 show collapse of the vertebral bodies that has produced a sharply angled kyphosis, or an anterior bending of the spine, which you can see most clearly in the third photo. In almost all cases, it's the anterior aspect of the vertebra which is affected, without any involvement of the neural arches. As part of the anthropological analysis, we performed a differential diagnosis, and the type and distribution of the lesions were consistent with infectious diseases such as tuberculosis and brucellosis. Tuberculosis is a disease that only affects bone in around 5 to 10% of cases, and it's usually the vertebral column and ribs where we see the very diagnostic changes. Collapse and fusion of the vertebra is typical, with the anterior aspect of the body usually the part most affected, which causes the same kind of wedging that we saw in the upper lumbars. Hypervascularization and destructive lesions of the vertebral bodies is also quite diagnostic, and that's something that we saw both in the cervical and thoracic parts of the spine. Tuberculosis also affects the joint surfaces, most commonly asymmetrically. If we look at the changes in the rest of the skeleton, certainly there are more changes affecting the right side of the individual. We've got involvement of the sacro-iliac joint, which is seen in around 7% of tuberculosis cases and usually presents asymmetrically. And we have active periostitis, which suggests an infection. A diagnosis of TB would also explain the lytic lesions seen in the scapula, which could be a result of the spread of infection out of the area of the thorax and into bones that are in closest proximity to the lungs. There's not really enough time to go through a full differential diagnosis for this particular case. We do have an article in Press in Spanish where we discuss why we excluded other similar diseases, things like osteomyelitis and brucellosis, which can present very similar lesions to TB and which can also affect the vertebral column in similar ways. In this particular case, the individual exhibited a patterning of pathological changes that was most representative of tuberculosis. Really, the only way to confirm diagnosis for sure is by carrying out chemical analysis, either through ancient DNA or mycolic acid, to determine which bacteria is present. And that's something that is currently in the works. So hopefully for the next presentation, we'll have a confirmed case and be kind of further along in the archaeological interpretation of the grave context as well. TB has been well documented in the Roman world, particularly between the 1st and the 5th centuries. These cases have been linked to increased population density as a result of urbanization, malnutrition, increased movement and contact between people, which may have affected the propagation of different infectious diseases. There are references in the medical literature of the time that catalogue a pulmonary illness that involves night fevers, cough, and wasting away of the body over months and years, which could certainly be an early description of TB. And while there are no known tuberculosis cases in Navarre from the same period, there are other examples in the Iberian Peninsula. One of the most interesting studies from Spain looked at a series of prone burials from a Roman cemetery in Valencia, where they found a direct correlation with atypical burial practices, again, the majority of which were prone, and the presence of either perimortem trauma or infectious disease. In terms of where we go from here, this is an ongoing case. We're doing chemical analyses. We've sent off samples for DNA testing, which can help us to distinguish between different kinds of bacteria. The excavations of the convent have been completed, and the conclusions from the archaeological investigation are that this may be the location of a previously unknown necropolis in the western part of Pamplona. Unfortunately, it is an urban site, so further excavations will only take place as part of building or restoration works in the area. And there's still a lot more research to be done on the presence of infectious disease in the Iberian Peninsula. What we can say about this one individual is that it's an unusual burial for the chronological and geographic context in which it was found. It's clear that the individual suffered from an infectious disease. The advanced stage of the skeletal lesions would suggest that they had lived with the disease during a substantial period of time. Although we can't state for certain that the burial treatment and the presence of disease are related, the case does contribute to a growing body of evidence within the Iberian Peninsula, at least of prone burials, and there are studies that are attempting to map and figure out possible relationships between these individuals who displayed deviant funerary rituals. What's clear during the Roman period is that different communities often had their own burial customs. And in the case of Pamplona, we really have a scarcity of data from the later Roman Empire. So we hope that with this example, we contribute just a small case that can be added to the literature. Thank you so much for your time. Like I said before, if anyone has comments or questions or similar cases that they would like to discuss, then we look forward to hearing from you. Thank you very much.